The U.S. government now accusing dozens of Russian diplomats of scamming more than $1 million from Medicaid. So they don't like Putin care, but they do like Obamacare. I think that should be the selling point then. Russians love it. Medicaid is the same program that many Democrats now want to expand, and the health care law dramatically does just that. Cato's Dan Mitchell says that is typical of the way the government throws money away. They don't look at where they've been throwing it prior. Dan, good to see you.
Good to see you, Neil.
What do you make of this?
I think this is an example that may finally get across to people that Medicaid is a failed program. Remember the bridge to nowhere back last decade, and sort of crystallized in people's mind how federal transportation spending was just a pork fest? I think this story about Russian diplomats bilking the Medicaid program may finally get people to focus on the billions of dollars of waste of this terrible federal entitlement that should be sent back to the states, just like we did with welfare reform in the 1990s. It really is outrageous. Diplomats of another country figuring, hey, let's go ahead and get American taxpayers to finance our health care costs.
But you have to tip your hat to these Russians, right? I mean, they found a way to make Medicaid work. So touche. But Dan, what I'm worried about is when they talk about needing more money for Medicaid, just as the good congressman from Oregon was talking about doubling the gas tax because we need more money for infrastructure, I think it's sort of the same theme. Just throw more money at it without accounting for the money that we've already committed. I mean, this isn't a matter of like a Social Security lockbox because there's no lock and there's no box. But we keep doing it.
We keep doing it because special interest groups benefit. Medicaid and Medicare, for that matter, and the other new parts of Obamacare are basically a way of artificially increasing demand and increasing third-party payer, which is going to lead to a lot more utilization of healthcare services in ways where there's no cost effectiveness, no efficiency, no intelligent allocation of resources. So if you're a hospital, a healthcare provider, you're just going to cash the checks as fast as you can. You're going to overprice your products because you know that consumers don't care because someone else, in this case American taxpayers for Russian diplomats, are paying the bill. And so it's a microcosm of what is wrong with government intervention in the healthcare sector generally. But as I said, I'm trying to be optimistic. This might be the example that finally convinces people we need genuine Medicaid reform. Do what was in the Ryan budget. Let's block grant this program back to the state. So at least if New York State wants to waste money on Medicaid, only New York State taxpayers are going to pick up the tab.
Well, it's a concept, but we've had these embarrassments before and nothing's come of them. But hope springs eternal, Daniel. Thank you, my friend. Good seeing you again.
Thank you.